Hi, everyone. Thanks for tuning in to Mayor Bowser's pre-summit conversational series for the upcoming National Maternal and Infant Health Summit. My name is Dr. Adam Visconti. I'm the Chief Medical Officer of the HIV, AIDS, Hepatitis, STD, and TB Administration at DC Health. So the countdown's on. Everyone needs to get excited because next week we're kicking off on Tuesday, September 15th at 2 p.m. Mayor Bowser's will virtually host her third National Maternal and Infant Health Summits. So this year's theme is rethinking our perspectives and retooling our actions. So a life course approach to improving maternal and infant well-being. It's just the challenge we need to continue working collaboratively towards improving the well-being of pregnant persons, families, and babies. The kickoff will be followed by a series of breakout discussions, and this is on Wednesday, September 16th, and this goes through Friday, September 18th. So the summit will feature panel discussions and community-led workshops, and a virtual resource expo dedicated to connecting district residents with local and national resources and supports needed to ensure that babies and their families and communities have what they need to thrive. Please log on to dcmaternalhealth.com. Again, that's dcmaternalhealth.com, and register for this year's events. Today, we're going to be talking about all things vaccinations and immunizations. So it's a pleasure to be joined today by a few of my colleagues that can help shed a little bit more light on this conversation. So let's have them introduce yourself. Heidi.
Hi, good morning, everybody. Thanks so much for joining us today. It's a pleasure to be with you, Dr. Visconti and Dr. Shah. My name is Dr. Heidi Schumacher. I am a pediatrician and serve as the Assistant Superintendent of Health and Wellness at OSSE, the Office of the State Superintendent of Education. It's great to be with you.
Hi everyone. My name is Dr. Encore Shah. I'm a pediatrician like Dr. Schumacher, and I am a medical officer at the DC Department of Health.
Thank you so much, Dr. Schumacher and Dr. Shah, for joining me today. So let's jump right in. So what are vaccinations and why are they important?
So I actually like to think about this in a historical context. So in the course of the last 200 years, humans and kids in particular were dying of all sorts of illnesses and diseases. Luckily, we were able to develop vaccines that essentially eliminated a lot of these illnesses and diseases from our environment. Like, we don't hear about anyone getting polio anymore. And the reason why is because we have a polio vaccine. So vaccines are the way that we can prevent illness, and they're safe and effective. So those are kind of really the very big picture reason of what are the reason for vaccines and how actually safe they are and how important it is really for everyone to get it.
Thank you so much. Yeah, it is definitely very important. But are vaccines just for you? Do they have sort of a broader value to the community or people around you?
I could start on this one. I think it's a great question. And one of the things that I remember learning when I was becoming a pediatrician is I had a friend say that getting your child vaccinated is one of the first things that you can do to not only protect your child, but to be a contributing member of society, to really protect other folks too, right? And we know that vaccines are important for your child, but it's really when the population overall, when all the kids, all the families, all the adults are vaccinated, that we really see the most impact. And so if we think about, so I'm a new mom myself, and I remember when my son was a newborn, really literally walking around and saying, I hope every person around me is vaccinated, because my son was too young to be vaccinated. And when I was pregnant, I thought a lot about that too. We rely on other folks around us to be vaccinated in order to protect the littlest babies, pregnant moms, older folks. So it's really part of sort of the community coming together to make sure that everybody's vaccinated to protect the individual and the bigger population.
You know what, Dr. Schumacher, that actually aligns really well with our responsibility in this unprecedented COVID-19 pandemic that we're all in. As we know, there's certain things that the city has done incredibly well, have testing, have easy access testing, have contact tracing. Most people are getting contact traced within 24 hours. There's a lot of resources that Mayor Bowser has put in to the district to really attack this COVID-19 pandemic. But it's really about what we all do and what we all do for each other, such as wearing masks, choosing our activities wisely, maintaining social distance. So in that same vein, we are able to not only protect ourselves, but other people if we ensure that we all, especially our children, are fully vaccinated. And especially as we think about the fall coming up, the flu shot. The flu shot is something that we could get right now to help prevent a COVID-19 and flu kind of double whammy that could really make people sick, don't you think?
Yeah, totally. It's funny, it makes me think about the times when we're at the grocery store and we're wearing a mask and we're feeling good about the responsibility that we're taking. We washed our hands when we went into the grocery store. We wear the mask, we're maintaining social distance. And then, that person comes down the aisle and they're super close to you and maybe they're not wearing a mask. And that feeling of like, oh, I did my part, you have to do yours, is the same thing I think we're talking about with vaccines.
Exactly. People should feel that if you don't have a vaccine and you're going around, if your child still has to get up to date on their vaccines and you're going around, maybe you should feel that kind of pressure that, hey, actually my family should make sure all their vaccines are up to date and make sure they get their flu shot. So we're protecting ourselves.
I definitely agree there, Dr. Shaw. Dr. Shaw or Dr. Schumacher, do you mind talking a little bit about how COVID-19 has sort of impacted vaccines and vaccination?
I can start, Dr. Schumacher. So in the late spring, when the pandemic really hit the district, the best thing we could all do to prevent our hospitals from overcrowding and us really not being able to get a handle on anything is for all of us to stay at home. And that was part of Mayor Bowser's stay-at-home order. But during that time, essential services were still open. So grocery stores were still open. Clinics and hospitals were actually still open, providing preventative health care. But, and understandably so, everyone decided to delay some preventive care visits, or many people decided to delay some preventive care visits to reduce their amount of exposure out in the community. That is good to help prevent them from increasing their risk for COVID-19, but it causes a huge delay in those really, really important preventive care health visits, such as prenatal care visits, childhood immunizations, childhood developmental screenings. So now as we entered the summer, we decided, let us develop a messaging campaign. Let's really communicate with our providers, with our families, to elevate the importance of these visits and ensure there's easy access and that it's safe. And that's actually one point I do want to make. Currently in the district, it is safe to go see your doctor because the providers across the district have made incredible precautions, safety mechanisms in place to ensure that as a patient, you're as safe as you possibly can be while seeking the actually needed preventative health care, chronic disease care, or urgent care that you or your family needs.
I'll jump in with just one other point, Dr. Shaw, building on that. I mean, I think, so I have the privilege to work with schools and childcare and helping them sort of think about their health and safety protocols and really make sure that our childcare centers and homes and our schools are really safe when DC Health gives the okay for all of them to be open. And one of the things that we talk about all the time with those providers and with families is, a world in which COVID turned life upside down for many people, right? And I think for many people, myself included, sometimes it feels like, oh my goodness, what can we even do? So much is out of our control. There's this virus ripping across the world. And there are important things that we can do, and they do make a difference. Wearing masks, as we've been talking about, is one of them, right? Cleaning and disinfecting, et cetera. But getting vaccinated and making sure that kids and families are fully vaccinated is just as important as all of those other steps, if not even more important, because we know that some of these diseases that vaccines can prevent are some of the deadliest diseases in the world, and a simple vaccine and making sure that friends and family, talking with your friends and family, making sure they're vaccinated too, including against flu, is one of the most important things that we can do to stay safe and healthy.
And what we know is that this is a real possibility of a illness that is prevented by a vaccine could kind of run amok in our community. I think we've all heard on the news different places in the United States having measles outbreaks. And the simple reason for that is there weren't enough people immunized against measles. So let us really try to prevent something like that happening here in the District of Columbia, on top of flu, on top of COVID-19. That's the last thing anyone wants. But we actually have a very simple solution for that, and that's making sure your children are fully vaccinated.
Thank you, Dr. Shah. I definitely agree with that point, and with the previous point about how that's definitely safe to go to clinics. I serve as the medical director of a clinic, and I go to a clinic every day, and we have robust health and safety protocols. Everyone is masked, and we get screening every day. So it's something that we want to make sure we're protecting ourselves, protecting our staffs, as well as protecting our patients. So that is one of our highest priorities. So I definitely reiterate that it is definitely safe to see your physician. But it seems like people have had challenges with that. Do you have to visit your primary care doctor or pediatrician to get vaccination? Are there other ways?
So in the District of Columbia, we have the second lowest uninsurance rate in the nation, and we have strong primary care access across all 8 wards. So unlike other places in the United States, every district resident and every district child has the ability to seek preventive and primary health care within a medical home. And we really talk about this as a medical home because it's whole person and whole family care. Immunizations are incredibly important, but so is getting a developmental screen, so is getting a well child check, so is getting an oral health check as well, making sure your social emotional needs are addressed. And all that's done in our primary care medical homes. So we have clinics across the district, private clinics, or major health center or major hospital systems have clinics, as well as we have a incredibly robust federally qualified health centers that have really open access, and that includes weekdays, weekends, and evening access. So we really think that should be the primary place to seek all care, all preventive health care, including immunizations. I do want to note, so we are in an unprecedented time, especially as we thought about through the summer. We saw a very large dip in childhood vaccines. So we wanted to make it even easier for families to get their children vaccinated. So we partnered with our school-based health centers, which Dr. Schumacher talked a little bit about, but really opening them up because that is a great access point, a great point that the community and the neighborhood knows, and opening them up for immunizations.
Dr. Schumacher, do you mind talking a little bit more about that?
Yeah, I'd love to. Thanks. So with huge kudos to the health department and to our Schoolbased Health Center colleagues and our colleagues at DCPS. As Dr. Shah mentioned, we have multiple school-based health centers across the district open and available for any family with a child age 4 or older to access vaccines at. And as Dr. Shah said, right, we as healthcare providers, the 3 of us know the best place is to get vaccines and well child care in your medical home. But because we know that some families might struggle to make an appointment, say in the time that they need to do it, these school-based health centers are just an additional access point. And so more information is on DC Health's website, the specific locations there. You can contact your school too, your child's school, because they also should have access to these locations. But it's I think a testament to the importance of this work together, and I mean that together, right? We in government work hard to try to make resources available, but we need collectively as community members, as parents ourselves, to make sure that we are taking that step to access the vaccines, to call our kids' doctors or our own doctors if we need to make sure we put steps in place.
Thank you so much, Dr. Schumacher. Dr. Schumacher, Dr. Shah, are there any other resources you can direct our viewers to, potentially being able to find a medical home or being able to identify FQHCs?
Yes, you can actually go to our DC Health website. So that's dchealth.gov and /immunizations. And that is where, that's our site for our immunization program, which has all the access points for childhood immunizations. Also has a reference to childhood primary care clinics, as well as our federally qualified health centers.
Excellent. Well, thank you so much. Are there any other things you would like to remind parents or any of our viewers about getting vaccines during this time?
I can start. I think as Dr. Shaw mentioned, right, what we want folks to hear, and I will say as a parent myself, I can sympathize with all the parents out there who are saying like, oh my gosh, there is so much stuff going on. School is starting. We're trying to log into Teams or Zoom or whatever network that our schools are using. We're trying to do our own logistics and try to get to work or get back to work and all the other things going on. Like this is just too much to handle. I totally hear you and I feel you. I feel that emotion. And I think the thing that I would say is there is almost nothing more important than picking up the phone to calling your doctor and asking those questions that you need to ask to feel confident in going to the doctor and then making that appointment and getting it done. Because I think collectively, right, we as a city, we are such a strong city and such a strong community. And this is such an important thing that we as parents, as community members, as doctors, as teachers, whatever our role is in the city, us collectively coming together to get vaccinated, to get the well-child care done. And as Dr. Shaw mentioned, this year more than any year to get the flu shot is all a critical step that we can do to really help the city continue to recover from COVID and be ready for sort of the next phase of hopefully getting back to regular life whenever we're able to do that.
And for the flu shot can help protect you from getting the flu, from spreading the flu. That is going to cause a lot of confusion in the fall when flu symptoms and COVID symptoms are similar, and more and more people are going to get sick. So even if you've never gotten flu shot before, this is your year to get a flu shot. It is safe. And you do not get the flu from getting the flu shot. So it's very, very important for not only you to get a flu shot, but be a flu shot advocate. Ask your family, ask your friends, your colleagues, anytime you're on a video call, did everyone get their flu shot? I think it's just like we talked about with how it's our responsibility in this COVID-19 pandemic. It's our responsibility to make sure that we're proponents and talking about the importance of the flu shot as well.
Definitely true. And there are additional access points for the flu shot as well, your local pharmacies as well. Excellent. Well, thank you, Dr. Schumacher. Thank you, Dr. Shaw. So on behalf of Mayor Bowser, I just want to thank you all for today's conversation. As a reminder, please be sure to visit dcmaternalhealth.com. Again, that's dcmaternalhealth.com to register for this year's National Maternal Infant and Infant Health Summit. Remember, this is going to be on September 15th to 18th. And you can also find some information at the website on all things maternal and infant health in the district. So we'll see you next time. Thank you so much.